We really have a setup that, we really are sole traders. You could come and you could grow, like for instance, I do 4 days a week in general practice and 1 day a week in sort of skin cancer stuff. I could take that 1 day a week and I could take it to another town and set up a practice there with everything we've got set up here. And that's something that we've created. Now, if you've got a special interest in the same calibre, our desire is to have that same drop-in sort of system. Let's just say it's endocrinology or diabetes, and you get a very strong interest in that. And so 1 day a week, you're sitting there just seeing some complex diabetes cases. And so how do we grow your special interest as well? Like you might say, yeah, I can do all that. It's like, okay, cool. How do we isolate that in the sense of that's a standalone entity for you as a sole trader? This is your business, okay? You're coming and we as a service provider are helping you out with, not just electricity and a room to rent, but it really is about marketing. How do we get people to understand what your offerings are and to get you in there? How do we make sure that, we are doing more than just making it set up so you got to run out and tell the receptionist when you want to call patients back. There's a system in place so it's running smoothly. So that's the stuff you don't need to be worrying about. That's what, the service entity is for, is doing that sort of stuff. It's not a case of simply just answering phones and booking appointments. It's doing all the other stuff that you don't often see. And to be honest, it's just sort of, in my experience, things that just sometimes just happen because it's always happened. But if you actually put focus and energy into it, you can create a much better flow of traffic and a much better streamlined approach. It's not a case of going, there's a chair, there's a desk, and, that's it. It really is going, how do we help you be a better clinician, a better businessman or woman, and a better special interest provider? Again, if you've got a special interest in something, we want you learning more about it. We want you blocking time off to go develop the professional sort of skills you need to get better at it. Not just to say, oh, that's my special interest and you're going to squeeze that in amongst the day. From a purely workflow point of view, it is not good quality medicine. It's certainly not good quality cognitive thinking to have to jump from a mental health, a depressed patient, to an antenatal patient, to a poorly controlled diabetic, to a male pattern baldness discussion. Like, it just doesn't work. I mean, you've been there, you've tried it, you don't do your best medicine. Whereas if you said, look, today I'm just doing skin cancer, today I'm just doing women's health, you're in the zone. And again, you get in that zone. I mean, I'm sure you've seen it before. There's plenty of studies that once you break concentration, it takes you 20 minutes to get it back in there. We don't want that. Now, we do what we've got to do, but that's not ideal. And we have a mindset of how do we make things better? How do we improve? That's what we're here getting. We're getting more doctors so we can improve our skill set, so I can be more focused on my patients in the same way. I would be encouraging you to do the same thing and going, this is it. This is not a case of you and me working differently. This is a case of we're all helping each other grow. And when we're helping each other grow, we can handle all sorts of pressures because it's fun, it's enjoyable. And the bottom line is it helps us serve the community better. And that's why, you got into medicine, was for service.